I think if America is properly instructed and informed and really gain the knowledge as to what's being proposed, I think America will not go toward a socialized system.
We're joined at the Daily Signal by Dale Bellis. He's the chairman and president emeritus of Liberty HealthShare. Dale, good to be with you.
Rob, it's a pleasure. Thank you so much for the invitation.
Yes, it's good to talk to you again.
Thank you.
Tell our listeners about Liberty HealthShare and what it is you do, and then I want to zoom out and get to some more of the policy topics.
Sure, absolutely. We are a nationwide nonprofit association of men, women, families that all unite together for the common purpose of paying each other's medical bills. And we do it without the help of an insurance company or the government, just a regular, systematic way to meet health care costs in a like-minded community of faith and values where my money, Rob, every month goes to somebody else who has medical bills. And then should I have costs, that same group is there to help pay my expenses.
Geez, it sounds like a concept that conservatives would really like, right? Get the government out of it
absolutely.
And help your neighbor.
It really does express our own individual health care freedom, because we're all about taking care of our health. Sadly, we live in a world where the healthcare system is about sick care, not health care. And so our focus is on health. Our focus is on being preventive. And when you live well and live focused on your health, costs are less. And when they do occur, we've got an entire support community gathering around you at that time of crisis. In fact, that's one of the distinctives of our organization. When you participate, every month your money goes to another person, and you know exactly where it's going. You can message them with cheer, with encouragement, with prayer, whatever the case may be. And it really draws everyone together in a support network that is so meaningful, especially when you're ill.
And how have you gone about building this network, this community of people who, do want to help out?
Largely by word of mouth, by being at events like this at CPAC, where liberty-minded people join together and are really highly interested. But through the internet and Google and whatever.
People who are looking for a
solution, an alternative to healthcare costs. We're not insurance. We don't want to be. We want to empower the individual, private pay individual, to take charge of their care, to create that relationship between themselves and the doctor, to be the one that the doctors look to for payment. We're just simply standing behind that individual, assisting them with those costs.
Now, take us back to the start. How did these health sharing services begin?
Well, they really have been in existence for generations, particularly in the Anabaptist communities, where particularly Amish and Mennonite are famous for really helping one another. It was in the early 80s, 1982, when the first healthcare sharing ministry launched as a result of what happened in the life of a pastor in northeastern Ohio. And he had a terrible accident. His wife was killed. Children were in the hospital. But people who knew of his ministry to drug addicts and alcoholics, he had a rescue mission, paid his medical bills in 45 days, $50,000 of medical bills. He said that's the way people ought to help each other, and launched the first interdenominational healthcare sharing ministry. It's just grown from there. The Affordable Care Act ensconced healthcare sharing in the ACA by really giving criteria for what is a healthcare sharing ministry, and kind of brought it to the fore. And since the ACA, it's exploded. We have about 1.5 million people across the country who are engaged with healthcare sharing.
And what drove you to personally do this?
I had one of those epiphany moments. When I saw the Affordable Care Act pass, I got up one morning to go to the office. I've been a healthcare administrator for decades. And when I saw the passage of the Affordable Care Act, it hit me like a ton of bricks, Rob, that there's got to be a way for the average, ordinary American to meet healthcare costs without being burdened and intruded upon by government and government regulation. Began to do my research and saw where this really was a viable opportunity for people of faith and values, and launched Liberty HealthShare in 2012. We are an extension of an existing sharing organization that's been in place since '95, and it's just been met with extreme excitement and participation, and we've grown wonderfully over the last few years. We've got 240,000 members in all 50 states, in multiple countries, and it's just continuing to grow.
And now we continue to see in the course of this election season healthcare dominate in the polls as an issue that is of great concern to the American people. What do you think that says about the state of healthcare in the United States and where we might be headed in the future?
It says that there are serious flaws in healthcare in America that gives people pause to wonder what are the mechanisms behind this drive of upward costs in healthcare. And they worry about it. And there are several flaws. One, frankly, is what I refer to the third-party pay system. We've based healthcare, the payment system, on a third-party pay relationship where I send my money away to a third-party insurance company. It suddenly becomes their dollars. They take charge of directing me in terms of my care. I lose autonomy. Now they're making decisions for me, and it's their money that they decide how that's going to be dispensed and dispersed. And that third-party pay arrangement makes the fact that the costs of healthcare are just hidden to me. I really don't know what the costs are. With beyond my premium, what I send to the insurance company, I don't know what healthcare costs. And in fact, the incentive is not there to even care.
That's so true.
What if I have to make a decision between a $30,000 hip replacement and a $100,000 hip replacement? My natural thinking is, the $100,000 got to be better.
Right.
I'll choose that one. That's not the case, actually, typically. But I have no incentive to control costs, and so for that reason, we've created this gargantuan, bureaucratic payment system in healthcare that is just cold and clinical and harsh, and people worry about it. That's really why I was so motivated to launch Liberty HealthShare, to say we've got to take healthcare and put it back in the hands of the individual consumer. It's my body, by the way. My body's a gift of God. I have the responsibility to care for my health. I need to be in charge and control of the care of my health. And so returning that power and empowering the individual patient for the resources to do that, which healthcare can be a scary matter, especially when you're when you're moving into that arena. And I think that's a big flaw. The other is, frankly, doctors are motivated to care for me if I'm sick. I go to the hospital because I'm sick. We tend to have a sick care system, not a health care system. So if we were focused on the care of our health, on prevention, on living our lives the way we know we should, right? Eat right, exercise, etc., it would reduce incidence of disease, and we'd be far better off. We've got to create that incentive. And there are a number of things occurring in the marketplace that do that now. I'm grateful for it. But by and large, it's a sick care system. We've got to, as individual consumers, reclaim our liberty and independence in the care of our health.
Well, I'm glad to hear you say that. Now, as you know as well as I do, though, there's a very contrasting view being portrayed by a lot of very prominent candidates running for office, in which the government would seize more control over health care, socialized medicine, Medicare for all, single payer, you go down the list.
Right.
Where do you think that's ultimately going to lead us? I mean, where do you think that the American people will go for something like that?
Well, number one, I think it runs absolutely counter to the founding principles of our nation. Our founders memorialized the rights of the individual, both in our founding documents with the Declaration of Independence, then with the Constitution. It's really centralized on the Judeo-Christian principle that the individual has value and worth. Socialism is the exact opposite of that. I contend it's immoral. It is a violation of that essential God-given value of the individual, because it's all about the collective. It's all about what's best for the masses. And I get lost not only in the masses, but some elite is in charge of determining what that value is. Not only am I lost in that mess, but I'll be eliminated if I don't go along. So it's authoritarian, and it goes absolutely against that very essential principle. I think that's what's at stake. And when America understands that socialized medicine is about a government-paid-for, government-controlled, autocratic, and dictatorial kind of system, they vote in overwhelming amounts against it. It's being sold, obviously, being branded in some pleasing fashion and manner right now. But when folks discover it, and the polls show this, when the questions are asked, are you really in support of a government-controlled, paid-for system? The answer, by and large, is no. So I think if America is properly instructed and informed and really gain the knowledge as to what's being proposed, I think America will not go toward a socialized system.
Well, Dale, I'm glad to hear you are articulating that message. It's something that we care about passionately at the Daily Signal and the Heritage Foundation. I want to thank you for joining us today. It is my pleasure to talk to you.
Thank you.